2026 is bringing big shifts to the Medicare Advantage plans and prescription drug plans. Between tougher quality scores, funding changes, new prescription rules, and cost sharing adjustments, it's a year of trade-offs. And now more than ever, you want to make sure you're reviewing your plan changes for the next year. In today's video, I'm going to explain the big reasons why Medicare Advantage plans are changing so much in 2026. We'll cover funding changes, quality scores, prescription drug coverage improvements, and why some costs like deductibles and copayments are going up. Plus, I'll share some real conversations I've had with my clients just this week because their questions are probably the same as the ones that you may have as well. Hello, my name is Edwin John Rodriguez, your licensed insurance representative. And on this channel, we discuss all things health insurance with a focus on Medicare and ACA plans. Since 2007, I've had the pleasure of helping thousands of clients compare, understand, and enroll in plans that fit their needs and goals. I often tell my clients I'm the best free help you'll never pay for. Now let's get into it. So why are there so many changes in 2026? The one big reason for change is funding. Medicare Advantage plans are paid by the federal government to provide benefits. The amount of funding a plan receives depends partly on quality scores called HEDIS, as well as star ratings. In 2026, the scoring standards are tougher. If a plan doesn't meet those performance scores, they lose out on bonus money. And then when that happens, insurance companies have to tighten benefits or raise certain costs to help balance things out. I had a client call me this week asking why her hospital copayment went up from $175 a day to $275 a day for next year. That wasn't the company being greedy. That was a direct result of funding shifts and how plans are adjusting to these new monetary restrictions. Another massive change is because of improvements to prescription drug coverage. Before 2025, there was a limit on how much an insurance company was able to pay towards prescription drugs at the pharmacy. And once you hit that limit, you would fall into what we call the donut hole, also known as the Part D coverage gap. At that point, you would then have to pay as much as 25% of the cost of that medication. This caused a lot of individuals' drug prices to skyrocket while in this gap. Now, as of 2025, that donut hole is now gone. The federal government enacted legislation that actually capped how much an individual can spend towards medications in the calendar year. Eventually, what happens is once you, the consumer, spend $2,100 in the calendar year toward medications at the pharmacy, you hit the catastrophic limit, which makes the cost for your medications a zero copayment for the remainder of the calendar year. This means no more worrying about when you fall into the donut hole, no more runaway drug costs with no ceilings. So once you hit that $2,100 in the year, you're done paying for covered prescriptions. This is a huge win for people on expensive medications. The next question you may be asking is, why are deductibles appearing on my drug coverage? Now here's the flip side. Because insurance companies are now on the hook for more of your drug costs on the back end, they're moving some of those expenses on the front end. And that's why you're seeing deductibles appear in the drug coverage portion for your 2026 plans. For example, another client I spoke to this week opened up her 2026 annual notice of change and was shocked to see that her plan now has a $615 deductible on her prescriptions. The answer is because while her costs are capped at $2,100 for the year on the medications, the insurance company is trying to recover part of that by charging more upfront. So while it feels like a negative change, in the big picture, it's protecting people from paying higher amounts for the later part of the year on their medications. Now, I have some good news. What if I told you you don't have to come out of pocket thousands of dollars in the beginning of the year? There's this new program called the M3P program, which allows you to be able to spread out your prescription costs for the entire year. So with that $2,100 cap, essentially what they'll do is they'll spread your prescription cost over the course of 12 months. So if you begin this program in January, you'll have this spread out over the course of 12 months, allowing you to make equal monthly payments of $175 per month for your medications. Now, the cost that goes towards this maximum is the cost of your actual prescriptions themselves, the percentages of any co-insurances you may pay, as well as any deductibles you pay towards your prescriptions, and finally, of course, your co-payments that you pay at the pharmacy. Everything except for your premium, of course, will go towards this maximum of the $2,100 at the pharmacy counter. Now, keep in mind, although the M3P program is free, it's not automatic. You want to reach out to your insurance company to register for this program and let them know you'd like to set your drug coverage up with the M3P program. They'll know exactly what you're talking about. And finally, as a reminder, this program is available to anybody that has a Medicare Advantage plan or prescription drug plan. Some of the other changes we're seeing for 2026 are increases to the doctors and hospital costs. Hospital costs are another area that are being adjusted. This year alone, I've seen plans go from charging 4 days of inpatient hospital care to now charging up to 6 days at a higher rate. That can add up quickly if you need a hospital stay. Same with the specialists. Many of my clients are seeing their copays double. The client I mentioned earlier, her cardiologist visits used to be $10. Now they're going up to $20 for next year. Those small increases across the board are how companies are balancing the books while still meeting the government's requirements of capping those prescription drug costs for consumers. Now next, let's talk about HMOs versus PPO plans, because the provider access for this is changing as well. Another shift for many of my clients in 2026 are that many companies are leaning harder into HMOs. A lot of plans that used to be a non-referral based plan are either adding referral requirements or cutting back on out-of-network benefits. That matters because if you like going to specialists without referrals, like some of my clients do, those options may no longer be available for your plan. For some folks, this opens up the door to consider different carriers or even to look at a Medicare supplement plan if they want that total freedom. So now you know, 2026 is bringing big shifts to the Medicare Advantage plan and prescription drug plan market. Between tougher quality scores, funding changes, new prescription drug rules, and cost sharing adjustments, it's a year of trade-offs. And while you may see some negative changes on some benefits, you also may see some improvements on another. If you found this video helpful, go ahead and give it a like. It helps other people find this kind of honest guidance. Also, make sure to hit that subscribe button so you don't miss out on future videos. Insurance rules are always changing, and being subscribed to the channel will make sure you stay informed and up to date. Also, if you'd like some expert advice, you can schedule a free call using the link below. We'd be honored to walk you through it. No pressure, no sales pitch, just clarity. And that, ladies and gentlemen, is why Medicare Advantage plans are changing so much in 2026. If you got value from this video, consider watching this video next. Until then, take care, and thank you so much for watching.